Well, I wonder what else will change. Let's begin. The article says that the Metropolitan Police Commissioner has written to Health and Social Care Services to say their officers will no longer attend mental health calls. So Mark Rowley did say officers would still attend if there was a threat to life, but the move is designed to free up officers to spend more time on their core duties. He added that this would prevent officers from taking on health responsibilities, The Guardian reports. He's given health services until August 31st until the Met starts its ban, but the chief executive of mental health charity Mind has expressed concern over the decision. In his letter, Sir Mark says, "It is important to stress the urgency of implementing this in London. Every day that we permit the status quo to remain, we are collectively failing patients and are not setting up officers to succeed. We are failing Londoners twice. We are failing them first, of course, by sending police officers, not medical professionals, to those in mental health crisis and expecting them to do their best in circumstances where they are not the right people to be dealing with the patient. We are failing Londoners a second time by taking large amounts of officers' time away from preventing and solving crime as well as dealing properly with victims in order to fill gaps for others. Officers spend an average of 10 hours with a patient when they are sectioned under the Mental Health Act, and this happens 500 to 600 times per month in London, a Met spokesperson said. Data from the National Police Study suggests officers spend almost 1 million hours a year waiting in hospitals and waiting for mental health patients to be assessed. That's the equivalent of attending 500,000 domestic abuse incidents or 600,000 burglaries. In a statement, the Met said, "Where there is an immediate threat to life, officers will continue to respond. In the interests of patients and the public, we urgently need to redress the imbalance of responsibility. Where police officers are left delivering health responsibilities, health services must take primacy for caring for the mentally ill, allowing officers to focus on their core responsibilities to prevent and detect crime and keep communities safe and support victims." Well, personally, I think he's totally right, and that should be spread out, in my opinion, throughout the whole country. Police are there to solve crimes. They're not doctors or nurses, and they don't really have the same qualifications or training to deal with such cases. Although admittedly, if you do have a complete butthead who wants to go around attacking people or something like that, then of course the police are required, as that would obviously be a life-threatening situation where someone may get hurt and a crime may be committed. Although at the same time you have got to think about the protection of the people first on scene, haven't you? Such as ambulance workers, for example. So what might be a good idea is they could do a bit of both. For instance, the ambulance could arrive with the police, and when there is no actual risk to life, then the police can carry on with their duties. However, of course, with mental health patients, I'm no expert, but I've heard that with some mental health patients, they can flip on a sixpence, if you know what I mean. Or at least their behaviour can anyway. So maybe the answer might actually be for a third option of something like a doorman security company or something like that to arrive with the ambulance and then call it in if things escalate. Because apart from eating donuts, the police do actually have an important job to do, which is obviously catching bad guys, not being a paramedic. Although whether they do that or not is another matter indeed. I mean, let's face it, we don't send ice cream men to put out a fire, do we? But either way, I do think that the ambulance drivers or the doctors themselves or whoever deals with the patient might need some additional protection. Although I'm sure there's other things that could be done other than just rely on the police. So it's time for the government to put their thinking caps on, in my opinion. Anyway, I should be back soon, so make sure you click that subscribe button down there so you don't miss my next video. I'll see you in the next one.